So we talked about this a couple of days ago, got you to weigh in. A lot of reaction to it as well. Christian Dubé, our health minister, deciding, you know what, it's time to force new doctors trained here in the province to work in our public healthcare system for the first few years. And by the way, he said just that, few. There's no actual detail as to whether that means 1, 2, 3. It's not in the plan yet. But this is being done in a bit to slow the loss of physicians who leave the public sector to go to the private sector or leave the province altogether. And we know that in the case of them going from public to private, those numbers have tripled literally in the last 3 years. Now, it's interesting, the CSN Union called on the health minister to put a stop to this kind of thing and seems to have gotten what they asked for. Caroline Senneville is president of the CSN. She's on the line. Thanks for being here this afternoon.
Oh, thanks for inviting me.
So based on what you've heard, and again, this is going to be brought up. It's not a regulation yet, but it looks like it will become that. What's in here that you like or don't like?
Well, what I like is that they're trying to stop the erosion of doctors going to the private sector. So that's the main thing for us. You have to understand that we have between 700 and 800 doctors that have left the public system to go to the private system. And if you look at the numbers in other Canadian provinces, they have a few dozens of them. So it's a really, really a big problem, just as the agencies are. And the health minister, Mr. Dubé, also wants to put an end to that.
You know, when you talk about doctors leaving the public to the private, and I made a point of talking about this when we asked listeners how they felt, the way the situation is set up in Quebec, and correct me if I'm wrong, you can be in the public system and decide to get out multiple times over the course of a year, right? 19
times. And if you practice telemedicine, you could be in the public sector in the morning and have your private practice in the afternoon. And as you know, since the pandemic, you can get an appointment either by phone or by a video appointment, and that has, we have no measures to stop doctors from doing that in the private sector and to charge for it, of course.
So that's an issue. Obviously, the minister's aware of that. I know that's not necessarily part of what might be introduced, but you know, the other concern, and this is what we heard from listeners, if you're forcing doctors who graduate to do this kind of stuff, you run the risk of having them leave altogether, do you not?
Well, we have the lowest tuition fees in all North America to become a doctor in the first place. We also have bursaries, not only loans, and we're the only province that gives bursaries. Also, you don't have to reimburse them. So I think it's part of a social contract. Your tuition fees are really low, and if you're smart enough, you can be a doctor. You don't have to be rich to become a doctor, but then you have to give back to society and practice in the public sector.
So I understand. It's funny because when I first saw that figure about it costs Quebecers somewhere between $470,000 and about $700,000 to be able to put someone through med school. Yes, it's because, and I didn't understand if that was all in bursaries and loans. It's not. It's in the fact that, as you just said, it does not cost as much here as it would in other places, and by a lot. Why wouldn't one of the solutions be to simply increase the tuition costs?
Well, no, because then you have to be rich to become a student in medicine. So, and I think that higher education is not a commodity, just as health is not a commodity. So, and you have also to take into account that what it does, when a doctor leaves for the private sector, he or she takes with him nurses, people working in the offices, and what they do in the private sector is what's easy and bankable. You don't see the private sector taking care of the mental health of homeless people. No, they do what's simple, when you have a good payback on your investment, and the rest, well, they leave to the public sector. And what they do, they also tell the doctors, well, you know, if you come into the private sector, and they do that for nurses also, you won't have to work weekends, you won't have to work nights, and that leaves the burden to the public sector, and that's what we got. That's why we're in the mess that we're in now.
So how do you begin, outside of this issue which would force you to work in the public system for whatever that fixed period of time is, what else has to be done here to make things better? We're still talking about 1 million Quebecers who don't even have access to a family doctor. Well, the government doesn't seem to have a plan to how to deal with that. Is this enough of a change to make a dent?
No, we have to stop the back and forth from the public and private sector. I think you should doctors' offices should be owned by doctors and not companies, for-profit companies, for example. Clinics and private hospitals should not exist. Private hospitals should not be financed. And there should be transparency. When you give money to the private sector, what do you give it for? And you know what? The private sector, health services is a way to make a profit. And if they don't think it makes a good profit enough, they're just going to leave. And you've seen it in, for example, private home for the elderly. Mm-hmm. When they're just not making enough money for them, they just close it, and then they say, well, you go elsewhere. It's not my problem anymore. So that we have to really stop health to be a commodity, a bankable commodity, and for profit. We don't think you should make a profit out of people being sick.
Right. I will point out, and someone else brought this up too, this idea of these private doctors or private clinics that exist. Other people will say they take the burden off the public system. If you're in the public system, you want to get a knee replacement or a hip replacement, you'll be in there for 2 years, 3 years if you're lucky. At least the private system allows people, if they and when they can pay, to take some of the strain off the public system by allowing people to get that done in the private system.
Well, we don't want to, the people are put between a hard choice, being taken care of later on and free, or sooner and you have to pay for it. Mm-hmm. I don't think that should be the way. You should be treated by the importance of your symptoms, of your disease, and not by the thickness of your wallet. But they don't take it away the burden, because what they do take away is the doctors and the nurses that don't work nights and don't work weekends, and they take away what's easy. If you go, for example, in a private hospital to have an operation, when you come in, you sign a waiver and telling them that if you have complications, you don't go back there. You go back to the public sector. So, because, they have a contract for a specific operation, they will be paid for that, plus 15% profit. Our tax money is paying for profits, for companies to make profits out of our diseases or injuries. Mm-hmm. And if something happens, well, then you're left on your own with the public sector.
I understand that, although the argument, I guess, on the other side would be as well, if you're going to get that operation, whatever it happens to be on the private side, right? At the end of the day, had you waited to be, as I said off the top, if you waited to be in the public system, you'd be waiting. So in the case of, they say justice denied, right? In this case, it's healthcare
denied. Yes, I know,
denied.
And I agree. And that's why we need to improve the public sector so people have access. And I encourage you to do the test. Go to the Guichet Accès Première Ligne, and if you do check the case, I'm ready to go to the private sector, mm-hmm. You'll have an appointment earlier. And is that the society where we want to live?
No, you're right. I understand theoretically no one wants that. We should all be able to get the health care we need, right?
I don't want to culpabilize the people that do it. But the thing is, we need a public sector to work for everybody, so nobody's put into that hard situation.
I would just ask you one last thing. You said a minute ago about doctors who are working in private, they don't work weekends, they don't work nights. The question comes up then, you're a doctor, you would like a work-life balance as well. And if you could find a better work-life balance, that balance, the way things are right now, is in the private system.
Well, then, if you're a doctor, you're there to take care of people no matter what. You take an oath for that. I like to argue. And then the thing is, we need to improve work, family, or personal life balance in every way. And I'm not saying that doctors don't work enough, or that, the burden has to be shared in all equity.
Okay, we will leave it at that. We're out of time.
And the more there are doctors in the public sector, the lighter will be the burden.
Understood. Carolyn Senneville, I thank you so much. Very much appreciate your time. We'll see how this one works its way through the National Assembly. Thanks so much.
Thank you. Bye-bye.